Hello, I'm Dr. Gerald Chodak. Breathing is automatic. The average person takes between 12 and 20 breaths per minute, typically without giving the action a second thought. But when you have asthma, that all changes. Breathing can be difficult, even painful. Breathing consists of two phases, inspiration and expiration. During inspiration, the diaphragm and the intercostal muscles, the muscles located between the ribs, contract, expanding the ribs and increasing the volume of the chest cavity. This causes air to rush in, passing through the respiratory tract and into the lungs. Once in the lungs, the air travels through a series of airways called bronchi. These airways in turn divide into smaller tubes called bronchioles, which end in tiny air sacs called alveoli. The process reverses during expiration, when the diaphragm and intercostal muscles relax, returning the chest cavity to its original volume and forcing the air out. However, for a person with asthma, the breathing that most of us take for granted isn't always so easy. That's because asthmatics have chronic inflammation of their airways. This swelling causes the flow of air into and out of the lungs to become restricted. And during an asthma attack, that airflow can become even more restricted, causing air to be trapped in the lungs. Three key changes take place in the lungs during an asthma attack. First, the lining of the bronchioles become inflamed and swollen, leaving less room for air to pass through. Second, muscle cells surrounding the bronchi spasm, leading to so-called bronchoconstriction and a further narrowing of the airways. And third, the lungs' mucus production is dramatically increased, resulting in a buildup of mucus that blocks the airways. During an asthma attack, breathing becomes labored and painful. Symptoms may include wheezing, coughing, and tightness in the chest as air tries to squeeze through the lungs' restricted passageways. This can result in fatigue, as well as difficulty exercising or performing normal daily tasks. Fortunately, the airway obstructions that occur during an asthma attack can be swiftly reversed. Usually, treatment with a quick relief inhaler stops swelling and muscle contractions within seconds, returning airflow and breathing to normal. Asthma can be a difficult disease to live with, but it doesn't have to be. Understanding how asthma works in your body can go a long way toward helping you control and manage the condition. With a treatment plan in place, you can keep your airways open and clear.